I'm Dr. Stuart Menakar from the Palo Alto Medical Foundation, Los Gatos Center. Welcome to Health Connections on KCAT Television, Los Gatos, Monte Sereno. Today we're here in the waiting room of our pediatrics department where it's really busy and a little bit noisy. But I'm here with Dr. Uyen from our Department of Family Medicine and Dr. Hanna from the Department of Pediatrics to talk about newborn and infant care. Thanks for joining us. First, I'd like to ask Iris, every new parent always wants to know, what do I have to do to prepare for having my newborn at home?
Well, you don't actually need that much preparation, but there are a few basic things. You do need a car seat to just even bring the baby home. You need a place for the baby to sleep, and it needs to be approved and safe for infants. So it must be a bassinet or a crib with a nice firm mattress. It would be good to have a thermometer that you can check the temperature rectally if you need to. Of course, you need burp cloths and diapers. That's about it. Some saline for the nose would be helpful. Most babies are a little congested.
When my son was born, we got all kinds of really wonderful fluffy toys when we were in the hospital before we got home. Is it okay for those to be in the baby's crib?
Absolutely not. So if they were to come up against a stuffed animal, might not turn their face to breathe properly. So those need to be far from baby.
And Uyen, is it okay if my baby sleeps in bed with me when we first come home from the hospital?
We prefer that the baby sleeps in a bassinet and a crib by the baby's self and not in the bed with the parents.
So as I understand it, we worry a little bit about SIDS, sudden infant death syndrome. Not a very common problem, but really devastating. So it is the recommendation of the American Academy of Family Practice and the American Academy of Pediatrics that all newborns sleep by themselves in a crib or bassinet and not in bed with parents. When they're a little older and they have control of their head and their body more, you can discuss that with a pediatrician or family doctor about whether or not it's okay to change. But for newborns, in the bassinet.
Every time.
Right, Iris?
Mm-hmm.
When we're talking about babies sleeping, we've talked about having them in a bassinet or a crib, but what's the best position for babies to sleep in?
Until the baby has enough neck strength to be able to turn his or her neck, we definitely prefer that the baby sleeps on its back.
Babies do a lot of sleeping. How much sleeping is normal for a newborn?
Boy, that's a tough question because you can't really force them to sleep. So they sleep up to 18 hours a day easily, but some of them are a lot less than that. So it's important to know how to comfort a baby after they've eaten and try to get them to be comfortable to go back to sleep again every 2 to 3 hours.
And they do a lot of eating.
They do.
How often should a newborn be nursed or fed with a bottle?
Sure. So in the immediate newborn period, certainly a lot more frequent than as the baby gets older. So about whenever your baby wakes up, it's a good time to feed the baby. And as the baby gets older, it comes to about every 3 hours. But initially, perhaps about every hour and a half.
And is it okay for me to let the baby cry at night and get my own good sleep? Or do I have to feed the baby every time?
It's preferable that you wake up and feed the baby every time until the baby gets older. Our cutoff is about 15 pounds, and so that's when you can start sleep training the baby.
So babies rule the roost?
For the first few months, yes.
And Iris, I know that all of us who take care of newborns recommend breastfeeding as the first choice for baby's food. Can you tell me a little bit about why, and what if I can't breastfeed my baby? Or, obviously, I'm not breastfeeding the baby, but what if the mom can't?
So breastfeeding is best if it's good for the mom also. So sometimes it's not quite working, but the reason why it's best is it does have immunoglobulins, parts of the immune system that are helping protect the baby. Obviously it has great nutrition and it's just more easily digested than anything else out there. If it's not possible, then using a bottle is fine, and sometimes people do pump breast milk and other times use formula. Formula is very well formulated, so if breast milk is not working as the first choice, then formula is fine to use. It sometimes needs to be encouraged and worked on with a lactation consultant if needed.
We're talking today about newborns and babies up to maybe 3 months or so. Should they be eating solid food?
No.
How about telling us a little bit about why? And when can they start solids?
Really, right now, the suck reflex, it's the baby's first time swallowing. The baby's just trying to get its nerve system working the way it needs to work. There's absolutely no way that the baby can chew. The baby can have difficulty swallowing anything but liquid. And the studies show that as we introduce solids earlier than later, there's maybe some issues with allergies. So definitely in a newborn period, it's solely milk.
About how old are most babies before they're ready to take some solids?
It's usually between 4 to 6 months of age that they can have the proper head control to be able to not just fall over as they're trying to swallow, and also be interested in the food. So you want to see if a baby's actually interested, and you can tell that. They start to kind of stare you down when you're eating. And the other thing is they need to no longer have such a strong tongue thrust reflex where they're constantly sticking out their tongue and pushing the food out. So in order to swallow, they need to be able to not have that tongue always sticking out when they put the food.
Well, so newborns sleep a lot, they eat a lot, and then something comes out the other end. So let's talk about baby poop. Iris, tell us a little bit about what's normal and what's not.
So back to the point about the breastfeeding, one of the things about breast milk is there's a natural laxative in there. And so breastfed babies have many bowel movements a day, and they're very loose. And when they start having solids, they're a little bit more formed. If they're having formula right from the beginning, then they're a little bit less frequent. Like anybody of any age, you end up needing to modify what you're giving to have the bowel movements come out easily. So when you start solids, you have to be aware of which ones are going to be a little bit more constipating and which ones are going to be a little bit more allowing the bowel movements to come easily.
Iris just talked to us about normal bowel movements. Uyen, what should we do if our newborns have some troubles with constipation?
So abdominal massages work. So if you just try and massage the baby's abdomen like the face of a clock, that will sometimes help. Like bicycling will just kind of help. Also just having the baby just on your arm, just against yourself, and just trying to somehow manipulate and just smooth the process out and just encourage a physical movement of the bowels will help.
Okay, Iris, do you have anything else to add about constipation in newborns and young babies?
So I guess I'm always looking for any excuse to have the baby be close to mom anyway, or close to dad. Just having skin to skin can sometimes relax them so they can just have a bowel movement. Sometimes rectal stimulation, if you use a thermometer, put some Vaseline as if you're going to do a rectal temperature, little stimulation at their bottom if they haven't had a bowel movement in, let's say, 2-3 days in the very young ones. If they are old enough to be having solids, they can have prune puree, peach puree, can drink some warm water. So warm water in a bottle up to the same number of ounces as they are months old can really help the bowel movements come more easily.
When newborns come home, everybody wants to see the baby. I'm not sure that's always the best thing to invite the whole world in to see the new baby. Uyen, what do you think about having lots and lots of visitors or taking baby out to parties?
You know, you really don't want your child exposed to that many germs, right? And so the more people the child's exposed to, the more germs possibly.
So germs and newborns, Iris, I know that all the little cousins and those kinds of things can be little germ factories coming into our homes. And with a newborn, maybe not always the best thing for the baby.
Yeah.
Do you have any other suggestions about how to protect the baby from illness early in life?
Sure. So first of all, really try and limit, as you were saying, in the first 1 to 2 months to really try and stall people coming in the first place. And then anyone who's going to handle the baby needs to wash their hands with soap and water. And I would say that anyone who's going to be touching baby also should have had their flu vaccine if it's flu season, and their Tdap to make sure that they're not transmitting whooping cough to the baby.
Tdap. What's that?
So it's the tetanus and acellular pertussis vaccine. And pertussis is whooping cough. Whooping cough can be devastating for a young baby, and they can't get that vaccine until 2 months. And even then, they don't have a ton of immunity with that first dose, but they can cough to death with whooping cough. So it might be an annoying cough if one of us gets it, and we might not think too long about coughing lots with whooping cough, but and not realize that we have it and transmit it to a young baby who can really have a hard time breathing with whooping cough.
Well, before we talk more about illness in children, let's talk briefly about how often should a normal baby see the doctor. So Uyen, could you explain to us a little bit about the usual schedule of visits in the first year of life?
Sure, you get to see your doctor a lot. The doctor really wants to make sure your baby's fine and to make sure that you're okay too. So the doctor will see you in the hospital, right? So the doctor will check on your baby every day when you're in the hospital. And then probably within the first 2 weeks after you've gone home, the doctor will also want to see your baby and you to make sure that the baby's gaining weight and to see how your family's doing with this new change. And then thereafter, the set appointment times are at 2 months, at 4 months, at 6 months, at 9 months, at 12 months, at 15 months, 2 years.
And it goes on and on and on for routine well checks. How about Iris? What's some of the most important things we do at each of those well checks? And tell us a little bit about vaccinations, please.
So we check for growth and development to make sure that the baby is actually growing well and that development is happening. The baby's learning to look more at you and smile and then start to laugh and eventually develop words and so on. So these are markers of development that we're looking for. We also look to get protection against diseases that would be very hard to either diagnose or get treatment for. So we give vaccines, and we really highly recommend the vaccines. And those are routinely given at birth, at 2 months, 4 months, 6 months, and 12 months, and then afterwards a little bit also. But in the first year, there are several. And there's a very well-researched schedule of giving the vaccines. We follow at Palo Medical Foundation the recommendations of the Centers for Disease Control. So the CDC website can be very helpful if anyone wants to refer to that.
And also at pamf.org. Remember, too, you can talk to your doctor about vaccines, learn about each and every one, and also discuss the value of them for your child. Now we've talked about preventing illness. What kind of common illnesses do we see in newborns and infants?
Well, fever is one of them, representing maybe a virus, maybe a bacteria. Sometimes we see constipation, as we talked about earlier. Sometimes we see vomiting and diarrhea, gastrointestinal illnesses, where, basically a stomach bug. Other things we commonly see might be breathing problems like wheezing, bronchiolitis and asthma. Other problems might be skin problems like dry skin, eczema. Very commonly we see different kinds of rashes, some of which are part of viruses, some of them are part of contact irritations with fabric softeners or lotions people are using. We often see troubles with feeding, with just trying to have a child eat in the first place, and so we work with parents on that.
So all kinds of things can give a little bit of trouble for your newborn and your infant, but at the Palo Alto Medical Foundation, we want to make certain that you feel comfortable taking care of your child. So if you ever have a question, give your doctor a call, whether you see a family doctor or a pediatrician, or if you don't have a doctor here for your baby already, come to the urgent care. We have doctors available all the time to talk on the phone, or to make appointments for you, or for walk-in appointments at the urgent care, but we want to make sure that you're comfortable and not worrying about your child. It's always better to call than to miss something. So nobody would wish colic upon new parents. It's tough on the baby, tough on the whole family. Let's talk a little bit about what colic is and some things we can do to help soothe babies who have colic. Iris, tell us what it is a little bit.
So colic just seems to be this nebulous discomfort in babies, tends to start somewhere around 2 weeks and somewhere around 2 to 3 months. So it can be really frustrating. It's usually in the evenings. And families end up saying that they just feel like their baby's stomach hurts. The best thing you can do is really try to simulate the baby being in the womb. So I always refer to the book Happiest Baby on the Block by Dr. Harvey Karp and talking about soothing techniques, doing a good swaddle, trying to do a side stomach hold so a baby's stomach is facing the ground, as I think you were mentioning earlier, doing a little bit of swinging back and forth, shushing right near their ear to let them feel like they're still in the womb and hearing that white noise, and sucking, so having them suck on a clean finger or a glove or a pacifier to just get them to calm down. Those can really help counteract the colic. And just a whole lot of skin to skin with family members really helps.
Okay. Any other ideas for the really tough kids?
Sure, so everything works for about 15 minutes. So you've got a vibrating chair, you have a swing, you have background music, you have the washer, the dryer. It will end, okay? Everyone will be better for it.
It is a tough problem. In my family practice, I've heard patients tell me that it works great to put the baby in their car seat in the back seat of the car and go for a short drive. The problem is, what do you do when you stop? So all of these things can help, and if they don't, please be sure to talk to your baby. Well, everybody loves babies' cute little bellies, but there's the belly button and the umbilical cord. How should new parents care for their baby's umbilical cord?
That's a really super good question, because that's 100 kids will have 100 belly button and cords. So the recommendation is to keep the umbilical cord dry, all right? So sponge baths or wiping the babies down until that umbilical cord falls off is good. If you get any green discharge, just wipe it off and keep wiping it off. If there's any redness, please call your doctor and bring the baby in.
Sometimes in newborns we see a little bit of yellowing of the skin. What's that about, Iris?
So we call that jaundice, and newborns don't have the enzyme yet to help get rid of the bilirubin that we all naturally get rid of through our liver. So that will start to kick in soon after baby starts eating and pooping, and it all goes out. But before that happens, well, some babies, their jaundice gets to be too much. So when a baby is severely jaundiced, they're yellow from head to toe. And as the baby is getting rid of their jaundice, they have less on the legs, then less on the abdomen, and the last place to resolve is the face. So you can see in the whites of the eyes that they're looking yellow, and you can see in the mouth and that they're have that yellow tinge. The better the eating is going, the less you're going to have this issue. Indirect sunlight can help, but definitely the best thing is going to be frequent feeding.
And when should parents see the doctor about jaundice?
When they think that jaundice is getting worse, it tends to peak in the first few days of life and then starts to get better. So the frequent visits you have with the pediatrician at the very beginning after you leave the hospital is partly to be checking this jaundice to make sure that it is starting to get better after those first few days. If it's starting to get worse again, that is something to alert your doctor about, absolutely.
One of the things that's most important for your baby is to have lots of good stimulation that will help with growth and development. We've talked about how you can stimulate the baby with different methods of holding, with skin-to-skin touch, with massage, working with the baby on sleeping schedules, eating schedules, constipation. But how about growth and development? There are certainly things that we can do as parents that will help stimulate our baby's brains. What do you think, Iris?
Absolutely. So the first thing your baby needs is you. They are already in love with you. They've been listening to your voice all this time in utero, and they just want to hear your voice more. So there's really no age where it's too early to be talking to them, singing to them, being really just present with them. So that means having TVs off, computers off, having all those other distractions that involve a screen away from them and away from you while you're interacting with your baby. Just talking to them, singing them, tell them your grocery list, talk to them about the weather, and feel free to read anything to them. When they're really young, it won't matter at all what you read, they just like hearing your voice. But as they get older, books that have pictures of baby faces are so intriguing to them. And then just there's no amount of skin to skin that I can underemphasize. It would be great to just have your baby constantly able to touch you somehow. Some people have pets. Pets can be very stimulating and wonderful for them to play with as they're getting older, like older babies and toddlers.
Uyen, any thoughts about interaction between newborn babies and their older siblings?
It's definitely desired. It's complex and complicated as with any relationship. The older child may feel as if the parent's attention is now only on the infants. The infant needs a lot of care, so then the older child may be feeling left out. Incorporate your older child in everything, and sometimes having one-on-one time with your older child will really make him or her feel much better. I can't really stress enough of having the baby looking at the sky, lying on the ground, and just trying to figure out his own or her own hands and feet and touch his siblings' faces and stuff. And just like, you need to not have any choking hazards around with toys and stuff, but just a lot of time together as a family, and just letting the baby kind of figure out the world tactile-wise as well as orally.
Uyen, any other thoughts about electronics in the home with a newborn?
Right. Currently, the Academy of Pediatrics recommends no electronics until the age of 2. So your child has not been outside of you and would love to hear the birds tweet, would love to feel the grass and how it feels, and the sky is blue and there's white and it's flowing out, and there's just so much in nature that doesn't stimulate the baby's brain as much as an electronic device would. So definitely no computers. You can definitely play music. You know, music's beautiful. Just enjoy the moment and be present with your child.
I'm very proud to be a doctor at the Palo Medical Foundation here at the Los Gatos Center. We have wonderful services for newborns, infants, other children, and all of our patients. Uyen, tell us a little bit about the services we have available for families with children.
So certainly in our new building here in Los Gatos, but throughout the Palo Alto Medical Foundation, we have pediatricians to see your child. We have family physicians to see your child. There's an urgent care here that's open every day of the week. It opens till 9 p.m. on weekdays and 8 p.m. on weekends at our facilities. And at most of our facilities, we have a laboratory if need be, radiology. We also have urgent care facilities so that if there's an emergency, you come on by and we can help you. We have a pediatric urgent care doctor here all the time. We have regular adult urgent care also.
So Iris, Uyen's listed some of the basic services we have for all children and family. Are there some special services we offer here that can help address needs that are not so common?
Sure, there are lactation services which can be really helpful when a new mom is trying to get breastfeeding going. We also have feeding classes that are within Palo Alto Medical Foundation that are led by our pediatric nutritionists. There's the starting solids class, sometime 0 to 1 year olds, and the other one that is 1 and above, also a feeding class by the pediatric nutritionists. They're excellent. They're through our health education office.
Do you guys hear things from parents that they've been told by grandma or Aunt Tilly or someone who thinks they know just what to say about how you should care for your newborn that maybe doesn't make the best sense as a doctor? Any thoughts about how new parents should respond to those things and what things are okay and are not?
There are a lot of old wives' tales out there, and it fascinates me actually to hear the number of them. Please feel free to ask your doctor about what your grandmother told you, or what your mom told you, because there are so many myths out there. One of them is you can't sit a baby up or you're going to hurt their spine, or you can't let a baby balance on their feet because they're going to have bow legs if you do that, or if your baby has a high fever, it's going to hurt their brain. These are all things that would be good to talk about with your doctor because they're pretty much myths.
Uyen, what kind of old wives' tales do you hear?
None strikingly comes to mind. I just really want to say that you've delivered a child, feel confident in your own abilities, and to not feel as if you need to listen to everyone else's advice because they've been through it. You innately know what your baby will want and not want. So be confident in that, and then be confident in your relationship with your doctor because your doctor will easily be able to answer any questions you may have. So that is always a guideline for you.
So Uyen, that's pretty easy for moms and dads and families where everything's going well, but we know that a large number of women have postpartum depression, or some people just call the baby blues, not all the way towards depression. What about that? How do we deal with it?
It's such a taboo topic, hypothetically, but it's actually super real. It's so common. There's a hormone surge. You've been pregnant, the hormones are high, you've delivered a baby, whether it's your first one and that was a whole new experience, or this is your second or third child and it's overwhelming having more than one child to take care of. And you got to just realize that you're right where you need to be at this moment. Take a deep breath. If you're feeling sad, you'll honor that you're feeling sad. You can definitely please talk to your obstetrician, talk to your pediatrician, because it's not anything bad. The hormone surge and just the amount of hormone you have in your body is more than you'll ever have the rest of your life. And then it affects the way you sleep, your emotions, you're crying all the time, you're feeling as if you're not able to care for your child. There's a lot that's going on, and definitely we want to be able to help you with this.
Iris, do pediatricians help moms with the baby blues, or does it have to be a family doctor or internal medicine or OBGYN doctor?
Oh, it absolutely can be a pediatrician. We're seeing you, as you heard, so many times in a year, and so we can definitely help provide resources for you. Resources that you can turn to and get help and get professional help, because it can make such a difference for you and ultimately for your baby. Of course, the best thing for your baby would be that you get help for the postpartum blues that are so commonly happening.
At the Palo Alto Medical Foundation Los Gatos Center, We have many, many pediatricians and family physicians here to help you take care of your newborn and infant children. We love taking care of the little ones. Please never hesitate to call or make an appointment to come see us, or come to our pediatric urgent care if you have something that needs to be taken care of right away. Thank you for joining us on Health Connections at KCAT Television.